Hi, I'm Zakila Hunley, and I am a nursing student in the nursing program, and I'm conducting my servant leader interview here at our local cafe, and I'm here with Jamina Liverman. She is a RN at a local hospital, and she has agreed to participate in my interview. So, Jamina, tell me, what is your definition of being a servant leader?
My definition of being a servant leader is an individual who not only um, can require or ask of what they want or what they need done, but who doesn't mind doing it themselves. If you're making rounds on your unit, even if you're in your suit and tie or if you're in your heels, a call bell goes off. As a leader, you expect your staff to let not one call bell, go off, then why you can't walk in the room as well to see, what's needed in there. Also, I feel like we're all called to serve. Just being in the medical field, generally, that career path right there, you're serving others. Whether you're a doctor, whether you're, a chaplain in the medical field, you can be a nurse, you can be in dietary, you can be a housekeeper. We all matter, and we're all there to serve. And it doesn't matter what your title is. So in order to be an effective leader, you must be prepared to serve first, and sometimes that means offering yourself. You have to offer self first. Because in order for you to know how the next individual feels, you need to be able to place yourself in their shoes. So, it's not all the time about do what I tell you to do, not ask me any questions. How about, not only do you do what I tell you to do, but I can come and help you. An example of that I have seen, one hospital I worked at, the CEO had asked the housekeeper on evening shift, what can he do to help her? And she told him that she was the only housekeeper on 3 to 11, and the first time, and that's, ironic, the first time I ever met the CEO of the hospital, he had on scrubs, and he was collecting trash with the housekeeper, and that's how I was introduced to him, and I didn't even know he was the CEO, but that was his way of helping her, someone who'd been at that hospital over 20 years. It was short staffed. He came from out his suit and tie, put on scrubs, and he worked every unit with her and helped her pull trash in all the patients' rooms, as well
That's
as
amazing.
yeah, he helped her because she was the only 3 to 11, but he helped her pull trash out of, each patient's room as well as the nurse's station. And they all went to, they both went to the basement together to dump the trash. And like I said, I had no idea that he was the CEO until after he left the unit. And another worker told me, that's Mr. Such and Such, the CEO of the company. And because the housekeeper was working short and by herself, he asked what he could do to help her. And she said, anything. And he just threw on some scrubs from the OR and came and helped.
Well, that's an excellent example of being a servant leader. But I've noticed with the change in healthcare, the new rules and regulations as being set forth and everything, in a manager role, I don't see too much servant leaders. Why do you think that is?
I think in the manager's role, it's not much of a servant leader. Managers, their time is very demanding. They're having to be in a lot of meetings, with everyone being on I call it, a 7-Eleven type thing, convenience. So people are paying for speed. People are paying for numbers. A lot of hospitals are doing things based on profit, and we have this saying that time is money. So if you can see 10 people within 15 minutes and get them in and out, and that's more money as opposed to seeing 5 people in 15 minutes. That's going to mess up the HCAP scores, and a lot of times places are doing things based on surveys. They're not actually there to see, okay, maybe it took a long time for a patient to get to the CT scan because, radiology had an emergency, there was a backup somewhere, so, that may have taken a long time for that reading to get done, but if you're not actually there walking through the units, seeing what's going on, or at least assisting or helping. It might have taken a long time for someone to wait on a patient. I work in an ER, and it's a lot of times there that they may not have what they call ER techs available. So even as management, we may have to go in, come out the office, and go on the floor and help out and do tech duties so that the nurses can get, the people triaged and seen sooner. Now that may take away from what my duties are as a manager, and I'm seen as an ineffective leader because it puts me behind in my work, for the people I have to answer to above me. But I'm able to put myself in my people's, shoes and go out there and help, because we're all there for one purpose, and that's to serve and take care of others.
That's well said. Would you describe yourself as a servant leader? And if so, give me an example of your ability to display this talent or trait.
Yes, I would describe myself as a servant leader. I'm very versatile, so it's not too many jobs that I can't do. Prior to going into nursing, I was a CNA for 13 years. So even in a suit, even in heels, it doesn't matter to me. I have no problem with going to help boost someone up in the bed, giving a bedpan with my suit on, heels on and all. I have no problem starting IV if, my eye may be better than someone else's eye. I can answer a phone. I still put in orders in a computer. I'm still helping doctors with procedures as well. So that's me, but that's nursing. That's being, flexible in nursing. And nursing is just one of those fields that's dynamic and it's ever changing. You have to be prepared to change with it, but you never forget the foundation. Florence Nightingale didn't. She was out on the battlefield with the soldiers. She was collecting data as well as, being a nurse scientist. And she never left that aspect of it. And she was a pioneer, a leader in nursing.
And what do you think you can do in a leadership role to empower others?
For me, I always try to find strength in other people. I have some people that are better handling children, so if we get kids, then I know that a certain nurse just has that spunk that, she's able to work with children. I have some nurses that are good with graphs, with numbers, doing stuff at a crunch. They love researching, they love looking up things. So I just try to find whatever that strength is in an individual, and I work with that to empower them. That's the talent that I hone on. Not saying that that's the only thing, because I also try to figure out what they're not comfortable with. I wouldn't call it a weakness, but what their comfort level is not, and I try to, get them into that, even if I have to. Sometimes, I faked that I didn't know anything or know how to do a procedure just to get one of the nurses who wasn't comfortable with it to walk through it with me or to do the procedure with me so they could build up confidence. So, I just believe in building one another up instead of tearing each other down.
That's good. And I've worked with you, for some time, and I have witnessed you, being such a good leader, showing servant leadership qualities. I had did a survey that was part of a course assignment, and it was a quiz on what type of leadership role, leadership that served. And with me, mine was participative leadership. And with that, I do kind of agree with that. I feel that I do, value the input of others, because like you said, in nursing you have to be flexible, and I feel that getting ideas and the thoughts of the nurses who work with the patient at the bedside, that's how you're gonna have a better and more efficient team. Everybody's gonna be willing to work together. Protocols and procedures and rules will be able to be implemented. properly and safely for not only the worker but as far as the patient.
Yeah, and physicians do it all the time. You know, you always have physicians, they will come together and they consult each other. You know, if you have a physician who doesn't have an answer or is seeing something he's never seen, you never see them afraid to consult one another and actually to refer the patient on, you know. And I think we need to do the same. You know, it's okay not to know everything, you know, and it's okay not to have the answer to everything. You know, it's okay to ask for help.
Yeah, you're right. So I just, hope that, as me being a student and about to finish in the next couple of months, and other, classmates, that we take what we learned from this leadership class and, put our learning into place and make sure that we continue to encourage each other and be better steward leaders that we are, now. And thank you for your time, and thank you, Jamina, for agreeing to do this interview with me.
No problem.
Bye.
Thank you for asking.